Aging Strong is Tufts Medical Center's injury prevention and outreach program that aims to empower older adults with information and resources that can really help them make great decisions to help them live stronger, happier, safer lives. So this program is sponsored by the Quincy's Health Department. And I want to thank our continued partnership for allowing me to continue to do my outreach work in this way. Today's guest speaker is Karen Wasserman, and she'll be talking about aging life care management. Karen is a director of Your Elder Experts at the Jewish Family and Children's Services. And I can't wait to have her share her expertise, what she does, and how many older adults and also their children can benefit from services that she offers. So Karen, welcome.
Thank you, Debbie. Thank you for having me.
So I know you have a PowerPoint presentation to share. Yes. But as you're putting on the slide presentation, can you just share with us what got you interested in the field of care management, in particular for older adults?
When I was in college, I really wasn't sure what it is that I was interested in doing in my career. And my sister and I overlapped for 1 year in college. And my sister volunteered every Saturday morning at a nursing home. And she dragged me along one day. And I was totally sold. Like, it was such a beautiful thing to be there. The residents of the nursing home were very happy to have our company and the program that we ran. And I could see there was a great need for older adults to have people involved in their life, interested. And I got hooked in that way, and I started doing some coursework at school, and then graduated working with college students, providing services in the community, intergenerational work. And then through the system, I went to work for an area agency on aging. And then from there, I went to social work school, and it wasn't very popular years ago to want to focus on older adults, but it was my thing. And there are lots of them out there, and they're growing. So yeah, that was a good idea.
Yeah. Well, I think it's a brilliant idea. I know going back into, I'm thinking about my nursing school years. We learned about gerontology and geriatrics and taking care of older adults, but you're right. It wasn't really, as far as the subject or the specialty, it wasn't cool enough, or, it was just, people talked a lot about surgeries and emergency care and, all these different types of programs and specialties. But geriatrics, taking care of older adults, that's boring, right? That's boring. What do they need? They're just old people, we'll just take care of them in the hospital. But I was talking with you before we came on how the older I'm getting, the more I appreciate that, oh my gosh, I'm considered an older adult. When my husband and I went for our honeymoon, we were in a cruise boat. We were the youngest couple on that boat because it was an AARP cruise boat, and those people looked old to us. And now I qualify to, being an AARP member, but it's just incredible how time flies. But then as we get older, we realize, oh my gosh, there's just so much complexities there are that we need to learn about, what the resources available for us as older adults and also our parents. So I can't wait to, listen to your presentation to learn more about, how older adults and their children can benefit.
So as Debbie said, we're going to be talking about aging life care management, which is a profession that rebranded several years back. It used to be called geriatric care management. And care management in general can be a confusing title because there are care managers and case caseworkers, and everyone works in a different setting. So there are care managers that work in insurance companies and caseworkers and discharge planners and care managers in hospitals and private home cares. So we tried to brand ourselves as aging life care managers in hopes to move a little bit away from the confusion of the title and to show that we work with people throughout the lifespan, because we're all aging. The age wave is here, as we were talking about. People are, our population is growing older. This is a staggering statistic that every day for the next 2 decades, 10,000 people are turning 65 years old every day, which is remarkable. And a lot of people are going to need care. So nearly 70% of individuals who are over 65 are going to experience some kind of a cognitive impairment. And nearly 50% of people over 85 will have some form of dementia. And the dementia is a generic title for Alzheimer's, vascular dementia, for some people who've had a head injury, strokes. So dementia sort of covers all of that. People need to know where to turn when they either start to experience a cognitive impairment, or they're having a physical issue, loss of ability to ambulate safely, or you're concerned about an older adult in your life, whether it's a parent, a relative, a neighbor, and where do you turn? So there are government programs in every community in terms of financial assistance. There's Medicare and Medicaid, which is confusing, and most people don't know the difference between Medicare and Medicaid, and there's a huge difference. There is subsidized housing out there, and Veterans Affairs that support veterans, obviously, but the subsidized housing can be independent housing, it can be congregate housing, assisted living. In Massachusetts, we are blessed with different kinds of mass health programs that will subsidize people in rest homes, assisted livings, and Medicaid is the insurance that pays for people long-term care in nursing homes after you've spent down your assets. There are, in Massachusetts, area agencies on aging that are organizations that provide subsidized care to older adults who are in need of physical assistance in several areas of daily life. And they provide care, I would say not a huge amount of care, depending on the program that you're in within the agency, the area agency on aging. But they do go out and do an assessment in your home and educate you about the programs that you're eligible for. Senior centers are awesome places to call for assistance to understand what the resources are in your community. And many faith-based organizations, churches, synagogues, they also have groups within their communities that hold a lot of resources to support people in the community. Faith communities often provide meals, rides to doctor's appointments, and then referrals to the community to get services that are greater than their ability to help people. Sometimes when people are looking to move, there are different ways of getting assistance, finding help to move to assisted living or move to a retirement community. And there are two professions that provide that. One is a free placement service where you go, you don't pay anything. However, the person who moves you or suggests that you move to a certain community gets reimbursed by that community. And then there is a fee-based service like myself, a care management organization, and other professionals who do pay for the time that you spend with them and refer you to housing, community assisted livings, and nursing homes based on our experience of working with our clients who are in them. So what is an aging life care professional? So we come from all different kinds of backgrounds. I'm a social worker, but I work with occupational therapists, physical therapists. There are nurses, mental health professionals, people who have had experience working in medical centers, who understand the system. It's professionals had experience working one-on-one with clients, with their families, and who feels comfortable in the medical model. Someone who's going to advocate for you when you're in the hospital or support you if you're in rehab. Someone who's not afraid to advocate, who knows who to go to and how to actually make sure that your needs are being met in a professional way to represent you when you need that kind of help. And I'd say that almost everybody needs an advocate in the hospital. Even I would be lost if I didn't have someone who was going to be looking after me when I was in the hospital. And sometimes even at a doctor's appointment, because we're all so vulnerable when we're in those settings. People become care managers, aging life care managers, have a profession for which they've been already trained. Many people who come into care management get there through the kind of work they were doing, as I was saying. And the nice thing about working within a professional organization is that there are strict codes of ethic and standards of practice, which we all try and live by in the work that we do. These are the areas in which an aging life care manager is knowledgeable. And I say it's not, as you see, legal is up there. It's not that I'm going to provide legal advice to you, but I know enough to know when it's important for you to seek legal counsel. And I know lawyers, usually elder law attorneys, who I've worked with, who are going to be vetted professionals. And that's true in all of the arenas in which we help people. In healthcare, we have connections with doctors that we feel comfortable with. In medical settings, in the assisted livings that we refer people to. We're working in the different settings that older adults need to access, either for living, medical care, that could include hearing exams and how to help people to, navigate medical care. People don't talk to each other. One doctor doesn't necessarily talk to your other doctor. And an aging life care manager makes sure that there's communication. A lot of adults, older adults, don't necessarily live near family or don't have family. And so there isn't someone to pick up the different pieces as our medical care becomes more fractured. And the life care manager is responsible for doing those things. Of course, we're not going to do those things if our clients don't want us to, because the extent of which a care manager is involved, because it is a fee-for-service program, is based on what our clients want from us. So we can do a tiny little bit of work. We can coach people and educate them and have a consultation, or we can be involved on a regular basis as needed. People come to us at different points. There are people who like to plan. I like to say that there are two kinds of people out there. There are planners and there are crisis managers. And planning is all well and good. And I think for many people, it helps them not feel anxious about the future when you feel as though you have a good read on what's available. But then there's the crisis that comes. And it could be that you weren't prepared for the crisis, or you were, and you're able to take the advice from a care manager and move forward. But for many people, planning ahead is not in their nature. So we are often being called, not for the planning purpose, but to step in the middle of a crisis. So we often get called when someone has already made it to the hospital. So it's not uncommon that we would get a call from an adult child, a son, a daughter, who may live locally or may live out of state or even out of the country. And now what? They're in the hospital. Someone's given them a long list of possible rehab, short-term rehab options, or hasn't told them that there are any, but has notified them that they're moving the next day to a rehab setting. And the family's like, what do we do? Well, if they haven't moved already, or they're not imminently moving, we could talk it through and talk about the facilities that we are familiar with and we feel comfortable recommending, or help them think about what the next best thing is, because there are limited amounts of rehab facilities, and there are that we are used to working with, and yet there are a lot in the area. And we can advise people. Like, one of the advice we have is, for when you go into a nursing home for either short-term or long-term care, is it's really important to connect with the staff. It's incredibly important to have a relationship, that they know that you care, that you're involved. And I think that does change the care which your family member has, because they become more of a person. So we help people with the discharge plan from hospital to a rehab setting, if need be. And then in the rehab setting, we are often called, we're not sure if so-and-so, our parent, can come home. Like, this is what they need to, we have the conversation, what is it that they need to be able to do to be safe to come home? What would it take to make it safe at home if they were unable to do exactly what they did before? Would it mean accessing home care services through the Area Agency on Aging? Would that be enough? Is it paying privately for some home care for a period of time to see if they can, with some support, be at home safely? And for some, the other option would be a respite stay in an assisted living, because it gives them more time to increase their strength and their independence, or to see over a more extended period of time whether or not what they do need is to live someplace where there's assistance. So there's a whole continuum of care, and we're often asked to come in and help advise people about what will be the safest, most appropriate setting for someone to live in, and which setting is going to be a good match, because each setting has a different personality. You know, there's good care and bad care and middle care, and all care has been affected by COVID. And, you know, what's going to be a good match for you? Is it a good match in terms of the other residents who are in the community? Is it a good match because it's closer to someone who's going to come visiting you on a regular basis? Do you know someone who lives in the community already? It's very hard to transition. I think as we get older, all the transitions become much harder. An example of someone who we've been working with recently is someone who was living alone, who had a stroke, and was at that moment, after this hospitalization, unable to go home, needed to go to rehab. And at rehab, you get more of a sense of whether or not you're going to be able to gain back enough to go directly home with some help, or for a more continued long, slower rehab. And there are goals. You work with the whole therapy team. It's often a physical therapist, occupational therapist, and a speech therapist, as well as the nurses and the doctors, to come up with incremental goals to get you to the point where you're your most independent self. And when you know what that goal is and you've had an opportunity to get to it, then there's that decision. In this particular case, it made sense to go to an assisted living for short term to see, will I be able to slowly gain my independence, my strength to get back home? And what will that look like? For some people, going home is made safe by some, adaptations in the house, whether it's grab bars and a raised toilet seat, or a tub in a shower, or moving someone's bedroom downstairs so that there's one floor living. And sometimes that can't happen, and we help people figure out what the next move is and what that entails. And we're not deciding which grab bar or shower chair we're accessing. Hopefully there's a visiting nurse or someone in the rehab that's going to, the physical therapist, the occupational therapist, who's going to make the suggestions that we then help follow through and make happen. Do the legwork. We do the follow through, whether it's the follow through to get a prescription filled, to make sure it gets delivered to the house. There's someone who's sort of providing that wraparound care to make sure everything happens for our clients. And truly, when we're working with people, it can be as simple as helping people connect to the resources they need. And for many of our clients, we're the point person for their medical care, because either they're cognitively impaired, that they're unable to follow through on everything, or it's too overwhelming for many reasons. And I think that as life becomes too overwhelming, that's usually a sign that things need to be simplified and less of a burden on someone's shoulders, as well as it's time for people to come in and support that person so they can be as independent as possible with the supports that can be put in place. And I'm aware that there's some key things that I'm always thinking about when I meet people. It is important to understand someone's finances, because if you don't understand what their financial resources are, you can't make suggestions that are realistic for them. And it can be very awkward when you first become a care manager, because like I was thinking, I as a social worker in a hospital setting, in a short-term rehab setting, I didn't usually ask people about money. And not everyone is comfortable talking about money. But if we're not upfront and ask, we don't know how we can support them. Are they going to be able to go home with 24/7 private care? It's extremely expensive. How long will their money last in an assisted living, if that's where it makes the most sense? And sometimes it's a combination of someone's physical health, therefore thinking about maybe how long they'll be able to be maintained in the community, and they're connecting that to the resources that they have. Resources can also be thought of as support. So it's the resources of family members, of the environment you live in, and whether or not there are supports there. And then you take into consideration capacity, someone's capacity to make good decisions. Now, making good decisions isn't necessarily something that you can say before they lacked capacity, they were a good decision maker, because there are people who've made bad decisions, and that's them. They're able to make bad decisions. And but when there's a cognitive impairment added to that, which is tricky, it's really important to recognize that and know that that's when you need to step in and help support someone. Family dynamics around people who have not been great decision makers are always tricky, and helping adult children see when their parent, who may have not made great decisions for themselves or for their kids growing up, are now in a situation where they need support. And it's difficult because everyone in a family has grown up and perceived the situation and tried to live their own lives, and now they have to make peace with what was and think about how they can be supportive going forward. And there's a lot of family dynamics that come up, and a care manager is also someone who can help them figure out what to do with those dynamics and how to focus on providing the best care for the older adult in their life. I help people think about whether or not they have the documents necessary. So the legal documents, the estate plans, the most important being a healthcare proxy, then having a power of attorney in place. And for many people, they don't know that there's something called a MOLST. And I actually wrote down what it stands for because I never remember. It's the Massachusetts Medical Orders for Life-Sustaining Treatment form. It is a medical document you fill out with a medical professional, and it needs to be signed by a doctor. It's not written in stone. It is something that can be changed over time, but I think of it as a roadmap to the care that you would want to get going forward. If you were in a situation where you needed more aggressive intervention to stay alive, these are the things that you are comfortable having done for you. These are the things you don't want to have done for you. It is also, in my mind, a gift to the person who's your healthcare proxy, because it can be an awesome task to think that you're going to be responsible for someone in the middle of a medical crisis. And sometimes people don't feel comfortable asking a friend, a family member to be their healthcare proxy because it feels like such a burden. But what I tell people is that if you've filled out the MOLST, your doctor has it, your healthcare proxy will have it, maybe even the hospital has it on record, you're actually providing them with the answers to the questions that they're going to confront. And then the burden isn't on them to try and figure out what the answer is, because you've already provided it with them, for them. Having a power of attorney is an awesome thing, and I highly recommend that as well, because if you are incapacitated and you can't access your bank account, you can't pay your bills, your mortgage, your rent, you're going to need someone who can step in, possibly temporarily, to take care of your finances while you're incapacitated. Those are the things that I like to talk with people about, so they feel like they have their ducks in a row, and for the information that I have, so that I can provide good advice and make suggestions that'll be sustainable for them.
Whew, taking a deep breath.
Yeah.
Karen, there's a lot of questions swirling around my head, and I could definitely see how it's important. In the beginning of your presentation, you were saying how different healthcare providers can become a care manager, and how important it is for them to know the system, the healthcare system, to be able to not be intimidated by it, and to learn that there are other specialties out there that can help support the person. So that I can understand that. And I can understand why there would be a social worker like yourself would be more than capable. A nurse would be more than capable, physical therapist, because we've all had our own lens, our specialty and training, and how it can best support a person. Now, as you were talking, the questions that you were asking that you would typically ask your clients, they're simple, and yet they have a way of directing clients who might be overwhelmed with not knowing what to ask, or not knowing, what else to do, So that coaching piece and asking the right questions, they seem simple, but yet they're enough to kind of help the family along to think about, okay, mom and dad, are they going to be okay going back to their 2-story home? Or maybe a respite might be something to think about. What is a respite? Are there any respite around here? Do we need to pay out of pocket? All these different resources available. So one of my questions, how would children of older adults, at what point would they finally say, I can't do it by myself anymore, I need help? When would they contact you or somebody like yourself to help them be able to maneuver the complexities of, the aging lifespan?
When I first started as a care manager, I feel like it was a secret. It was one of the best kept secrets. And over the years, I've seen more and more care managers sprout up. So it's a growing profession, which makes sense. And yet every day I hear from people who say, oh, I wish I knew that you guys existed. Or I've told every person in my life what a care manager is because someone's going to need it. And I don't want to, have not told them the importance of it. I think that there are people who don't necessarily reach out for help, in their lives. They feel like they should be able to do everything. And it becomes overwhelming and stressful. And for the most part, that's the sandwich generation experience, where the adult child is caring for their own family, possibly working full time, and now adding on the care and responsibility for an older relative. And so everybody's going to reach out differently. And as I was saying earlier, there are so many ways of getting support, whether it's many doctors' offices now actually have resource specialists and social workers on staff that provide support for their patients. There's the Senior Center and the Council on Aging, which will also do outreach work with social workers in their communities. And all of those people know about care management and are starting to refer people to care managers. Even discharge planners in the emergency rooms and on the floors in hospitals are learning about care management and making referrals to individual care managers in private practice or people like myself who run a group practice. And so it's never too soon to ask for help. But often people wait until they realize they can't do it anymore. They can't handle the stress. It's taking a toll on their work and their family and their own health. And so asking for help wherever you start will hopefully at some point lead to the level of support that you need. But again, there are some people who are going to ask for help and others who just feel they need to do it themselves. And care management has a price tag to it. A private aging life care manager does charge for their time. And what I try to help people think about is that even a little bit of time can go a long way so that you're not recreating the wheel. But by contacting, even consulting with an aging life care professional, you're not going to be recreating the wheel. You're going to just know what's out there. You're going to know how it works, who it's appropriate for, what it costs, and how to make it happen. Mm-hmm. And I can only encourage people to reach out for help. It's very hard. I've met a lot of professional care managers who said they got into the business because they were helping an older adult in their life, and they realized the importance of the work and felt as though they had something to offer others. And sometimes those people were born care managers. It's in their DNA. It's not that I think that those people will not be the best care managers, because some of them are. I'm a little biased that I think that a professional who's come out of training and had a lot of experience working in the system is someone who might be a better match. but there are all sorts of people out there and professionals, and sometimes you have to shop for your care manager. Just like people say you can shop for a therapist, a psychologist, a psychotherapist, you might want to make sure that it's a good fit. The beauty of working in a group practice is very occasionally it's not a great fit, and we're able to change the care manager to someone who might be a better fit.
Yeah. You raise a very good point. It's really good for people to do their homework. Just like if you were shopping, no, I don't like to use the word shopping, but they're just as if you're looking for a primary care doctor. You have a health insurance, then you have a list of doctors to choose from. Mm-hmm. These days, rating is so important, and then you look for the ratings, and then, or maybe you look for.
No, don't look online for ratings.
Well, that's the mentality, right? And then maybe some people might take another step and say, oh, okay, maybe I need to get references. References, I believe, is so important, because then you're getting to the heart of the matter. How is this person? Are they really personable? Are they easy to talk to? What's their background? Are they really as good as they, it's shown on the ratings, so asking for references, I believe, is so important.
Someone I work with asked me recently about where we get our referrals from in my care management program. And I said, the largest group is from word of mouth. Mm-hmm. It's from clients we have worked with who have told other people that we exist. And that is a true vetting, right? That someone is trustworthy. When we work with clients and we're looking for, say, a nursing home placement, and we make some recommendations, we can either give someone a list, we can call the nursing home we have connections with and introduce them. We sometimes go on tours with our clients, because it's a big deal to go into a nursing home maybe for the first time. And when it's for your family member, it can be extremely emotional. And so we're the other set of eyes and ears to talk about it afterwards and to ask questions while we're there. And then our clients will look online and see that nursing home didn't get the full 5 or 4 stars rating, but this other one does. And, we're able to say, okay, it's important that there is a rating system, but it is not the be all and end all of whether a community is really a good place to go. But we can say we're in and out of that community. We have clients there. We've worked with the staff. We can talk about the pros and the cons, but please don't choose a community based on how many stars they got online, because there is so much information out there and it is not all equal. Mm-hmm. The quality of it is not all equal.
Yeah. Well, I totally agree. I agree. Now, for children who live out of state, you mentioned there could be children who are professionals, or they chose to move out of Massachusetts and they hear their parents are still living in Massachusetts and they're becoming more and more frail. And, the children hires an aging care manager to help their mother or father, because maybe one of them's having surgery, or maybe one of them is, becoming more and more forgetful. Mm-hmm. So what a care manager, once they establish that, okay, we're going to take on this case, mm-hmm. clients, what do you do? Do you meet with the clients in their home, or do you is the communication mainly between you and the children who hired you, or is it both, the children, also the clients?
It could be one or the other or both. we like to meet our clients. We like to meet them in their home because I think it tells a lot about who they are and how they're managing. Are there piles of mail because it's too overwhelming? Is there old food in the fridge? Is the place falling apart? Is it neat and tidy, but they are not giving accurate information about what's going on in their life? It's so important to meet our clients and see how they're functioning. But there are adult children who just want to be coached. They want to be able to provide the care if they're local, and to be the communication with the medical professionals. But they rely on us to talk about the options, to talk about how to strategize around providing the best care. So I have worked with adult children where I never met their parent, because either their parent would never agree to meet with me, or they feel like they're the best person to be interfacing with their parents, but they need the information to do it appropriately. And there are people who we get referred by their adult children, but they're our primary, the older adult is our primary client. And they might not want us to be communicating with their adult children about everything. And since they're our client, they're the identified client, and they're cognitively intact, we would go based on what their what they preferred. More often than not, we are facilitating communication between family, sometimes close friends that are involved, the client, and the medical profession. We're trying to make sure that everyone's on the same page and has the same information. So we are fact-finding, fact-sharing, and trying to keep everyone up to date.
Now, how long do people use your services? Is it something maybe a one-time consultation, like a coaching that you just kind of mentioned, where the older adult children just needs coaching on how they could best support their parents? Would it be like 1 or 2 times, or would it be like a month, or is it something that could happen like quarterly, just to make sure they're ready for the next leg of the information or task that they should be doing?
Yes, there are these one-time consultations that we do where I may never see them again. It could be with the adult children and their parents, or just the older adult who's coming in because they want to be thinking about their future and want to know what their options are, and I never see them again. I have done a lot of consultations with older adults and or their adult children, where I do a consultation, and 2, 3, 4, sometimes 5 years later, they come back because either the situation's changed, or they didn't necessarily get to the point where they followed what we had talked about, or they want to check in again to see if the plans that we had discussed were still appropriate. And then I've had people who I see like every 2 years, they just want to check in. Inevitably, somewhere along the line, something changes, and so tweaking what their plan is useful. There are people that I work with, and I help see them through a transition. So we might help someone from out of state, someone's parents move to the area, and sometimes vice versa. We help people who are living here make a transition to another state to be closer to family. We work with care managers in other parts of the country to do the other end, so to speak. And so we might help for that transition, identifying where to move, talking about the services and supports that can be in place for a transition. Many people never want to move because they think it's such an overwhelming task. And families feel like they don't have the time that it would take to do the move. And there are actually professionals that come in and can help, whether it's they organize the actual move, the physical move, or they help people downsize so that the move makes more sense where they're heading and not taking everything they own with them to a smaller, usually, environment. There are professionals that will help people walk through each stage of the move so that it is not as overwhelming. Emotionally, it's hard to move, but to do the actual physical work, there's a support in place. And we refer people to professional downsizer movers all the time. So there's that piece of work that we call sort of like a medium piece, identifying what would be an appropriate community to move to, what services will be needed, what needs to change if it's moving location, different doctors, different providers, and then seeing them through the move. For others, it is a much longer term process. It could start with a crisis, but it could turn into there's a caregiver at a distance who needs the eyes and ears here to make sure that the care that they're paying for is actually being provided appropriately. You know, when we don't hire home care providers, we connect people to private agencies, but we are there enough to know whether the care is being provided. And so we're the eyes and the ears in the home at the medical appointment. And so we've had clients that we've worked with for over 15 years. We've developed a relationship with someone who wouldn't otherwise be able to be managed in the community, whether independently in assisted living or a nursing home.
Now, how do you decide, or do you, as far as referring people to different types of assisted living, visiting nursing, how do you know that those companies are going to provide the best care for your clients? I know you say that you see that you're there regularly enough to make sure that the care is being given, but how do you initially would refer an agency? Would that also be something word of mouth?
So our clients work with many different visiting nurse associations, with different hospices, and the assisted livings in the area we're in and out of, some regularly, others not as often, but we have colleagues who are in and out, so we can ask. Places change. That has always been true in services for older adults, that administrative executive directors, head nurses, there can be a shift. One place that we thought was the best nursing home with a change in management could become a place we don't feel comfortable with anymore. So it is a moving target. However, if we're referring to a place, it's often because we've had people there recently. We know someone who's there, a colleague either within our team or people we can talk to who are in other practices to understand the care that's being provided at any given time. We do work with probably 24 different private home care agencies and have a sense of who has availability, who doesn't. We meet new providers when we are hired and there's already care in place. So we're trying to refer people to known entities, to known communities, to known providers. And if in fact someone is discharged from a rehab to home with the visiting nurses, and it's someone we don't know, we're going to make sure that they're getting the care. And if it's not a good fit, we're going to do what we need to change it. Because again, in a post-COVID, I like to say post, I know we're still all sort of living in it, but there are not enough providers out there. There's a shortage. There's a shortage of personal care providers in home, in the subsidized programs. There's a shortage of nurses and rehab folks in the visiting nurses. So, is an agency bad? No, they're just struggling. And we're always looking for one that is a little bit more rich in their staffing.
Yeah. Yeah. You mentioned COVID. How did your practice and similar practices, how did COVID impact your work, and how has it evolved because of that?
Sure. Well, I'd say it was devastating. I know that we were not in the worst of it by any means, but we weren't allowed to visit many of our clients. So people we knew who needed to be with others emotionally were isolated. We're not getting the medical care that they might need. We had to shift very quickly to helping people do telehealth. We still actually have to go to some of our clients' homes to set it up, to have the telehealth meetings. From running a program financially, our revenue almost completely dried up. And we hung in there long enough to see the need afterwards just go wild. And I can't hire enough care managers for the work that's out there. I'm constantly looking for another person who wants to become a care manager because who has the background for it, because there is such a great need. We saw so many of our clients more depressed, experiencing more medical conditions because of the depression, the isolation, maybe not the prompt medical care. We lost a lot of clients, and we felt for the communities that lost huge amount of clients that we have relationships with. And it's hard. It's hard to feel good when our clients say, I don't want to go there. They lost so many clients, so many of their residents. It's like, well, that was true everywhere. Some of them wound up written about in the Globe. Some of them were kept secret. You never know. I mean, everyone took a hit. People were ignorant about how to manage. And the truth is, when it came to providing a lot of education and resources to services for older adults, we were last. So it was hard. And the care managers, once we were able to go in, were putting themselves in situations where they were going to be exposed. No, we were wearing masks. We were protecting ourselves as much as we could, but we knew it was our job to make sure that our clients were getting the care that they need. And for the most part, the team felt like they had to do it. They had to actually go out there, stay as safe as possible, but keep their clients' care moving along.
Where do you see aging care managers? Where do you see them making the most impact for the aging population? I mean, we're going to have our as you mentioned earlier, we're living longer. We're
Yeah.
living longer. That means what? There's going to be more needs, whether it's mental, physical, spiritual, any type of, help. Where do you see the importance of your work and how it can really help the aging population?
People are living longer, but they're also coming to a point, because they're living longer, that they have a lot of chronic medical issues, that they're becoming frailer, aging in place. Their needs are increasing, and they're relying on their maybe older adult children who are also aging. I have worked with many people approaching 70 who are caring for their parents, and have been for maybe almost 10 years caring for their parents. It's become a big part of their life, maybe a life where they thought that they were going to be a little less burdened by responsibilities. The needs are just growing. The big business out there is also growing. The amount of assisted livings being built, the home care agencies that are cropping up everywhere. There's need for care managers to help people get to the services that are truly going to provide what they need, to do the vetting for them, to help them understand this overwhelming sea of resources. And I also see our job is to help people think about the care that they provide in terms of what their wishes are, to help people understand that palliative care is an option, that hospice care isn't a death wish. It's actually allowing people to get the care that they need without being aggressive. Like, helping people have an end of life that's comfortable is not a bad thing. Mm. And care managers are able to educate people, not in the middle of a medical crisis in the hospital sometimes, but sometimes in their home after discharge, when it's clear that no one knows exactly what to do and where to run. And we can help people sit down and think through the options. Mm-hmm. And I think that is only going to grow, the need to educate people about what's out there, mm-hmm. and help them come to the point where they're choosing what they really want.
You said, as life gets overwhelming, it's a sign that things need to be simplified. Mm-hmm. I think that's just, that is so perfect in what your expertise, what you could do for families out there, how you can turn something so complex and how you could help them navigate through the system, through communications, asking the right questions, connecting them, helping them see, helping them kind of accept certain things. So, Karen, I just want to thank you for being on this program, Aging Strong. I learned so much from you, and I hope other people out there who will be watching this program will be able to gain so much from this program. If people have questions, more questions that pop into their mind, their head, how can they best reach you?
I can say the phone number out loud. It's 781-693-5052. You can also find me at yourelderexperts.com. And if you're looking for an aging life care manager in your area, you can look online at aginglifecare.org, and you'll be able to search the nation for a care manager nearby.
Great. I want to thank you again, Karen, for being on the program. I want to thank the Quincy Health Department for continuing to sponsor this program. I want to invite you all again next time and to learn more information that can empower you to make really educated and informed decisions. Until next time, take care, everybody. Bye-bye.